Hi, I'm Jodi Hittell. I'm with CentraForce Health, and I'm Vice President of Sales. I mainly work with our payer clients.
My name is Chris Geppi, Vice President of Sales with CentraForce Health.
I'm Dr. Steve Newman, Executive Chairman and Chief Medical Officer of CentraForce Health. Today, most payers and providers rely on electronic health record data, claims data, or publicly available data in an attempt to understand their patients and members. Unfortunately, this does not work. CentraForce Health has a unique, comprehensive array of risk scores, which for the first time allow payers and providers to truly get the complete picture of their patient or members.
Let's face it, healthcare consumers are busy with their lives. And for the 4,000 hours between office visits, there's a lot of things happening in their lives that healthcare providers aren't even aware of. Decisions that are made based on incomplete pictures are ineffective and very expensive, actually. Data that's collected in the electronic medical records are typically outdated and actually insufficient. Even standard social determinants of health information really only reveals a sliver of the patient or member's lives. And so really you still need more information to fill this gap.
We know that the average patient or member only spends 90 minutes a year within the four walls of the healthcare system. Think about that in the context of there being 450,000 minutes in the course of the year. Relying on EHR data, claims data, and publicly available data will not tell you what's going on outside of the four walls of the healthcare system. What you need are the CentraForce risk scores and comprehensive determinants of health in order for you to close the gap in your data.
You need to close the gap between the data that you have today and the data that you need to ultimately improve clinical and business outcomes, improve engagement, and ultimately treat the member or patient in a way that improves clinical outcomes and the cost of care.
CentraForce Health's 125 comprehensive determinants of health are complementary to your current data sets. These insights will not only just help you understand your current members and populations better, but it'll also help you communicate more effectively with them, acquire new patients, and identify areas of risk within your current populations.
Let me share with you an example of the power and value of the comprehensive determinants of health that was recently experienced by one of our clients. One of our clients is a mid-size payer that operates across the state of Florida. They sent us 90,000 commercial lives to be profiled. These commercial lives were previously felt to be healthy by the chief medical officer of the plan. We scored these 90,000 members with, first, the standard social determinants of health, and second, the CentraForce Health comprehensive determinants of health. The CentraForce Health comprehensive determinants of health identified 29,000 of those members with unseen health risks that can translate to chronic disease. When extrapolated to the cost, this is an unseen liability for the health plan of $158 million.
I know you have lots of data and you probably don't want more data. What we provide are actionable insights that you can use on day one to better engage and manage your patients and populations. For example, our engagement scores are very unique in the healthcare industry in that they're specific for healthcare information. So what that means is that our communication engagement scores will allow you to identify the best channel to communicate with your patients and members, such as email, text, or phone. and the most trusted messenger to communicate with your patients and members, such as a pharmacist, doctor, or nurse.
There is much, much more information to share, and I would appreciate the opportunity to learn more about your organization and your specific needs. With that said, I am confident that we have solutions that will meet the specific needs of your organization that will ultimately help you to improve clinical outcomes while reducing the cost of care for your organization. Please click the link below or otherwise reach out and let's schedule some time to talk in more depth about how CentraForce Health can help you with a specific solution that meets your needs to better care for your patients and members.